were right about everything. This is a must-read. Censored Truths Unveiled. RFK Jr., McCullough, and Malone expose COVID treatment suppression and Big Pharma's $100 billion cover UP host. Welcome to Censored Truths Unveiled for a groundbreaking 3-hour deep dive into the explosive congressional testimonies and interviews from late August to early September 2025, featuring HHS Secretary Robert F. Kennedy Jr., Dr. Peter McCullough, and Dr. Robert Malone. They're delivering a mountain of facts, claiming life-saving COVID treatments like ivermectin and hydroxychloroquine were deliberately suppressed to protect Big Pharma's $100+ billion vaccine profits, which bought off politicians with billions in campaign donations and flooded media with ads, like those brought to you by Pfizer, spots saturating TV. They argue those who believed treatments worked better than vaccines were right all along but faced unprecedented censorship, with millions silenced for speaking out. We're tripling the details from their testimonies, including the James C. Smith Reuters Pfizer conflict, and we'll close with a staggering free speech crackdown that silenced truth tellers. Gentlemen, welcome. RFK Jr., thanks for the platform. The public's been betrayed, and I'm here to expose how Big Pharma buried treatments to rake in billions while censoring those who dared speak the truth. McCullough, it's a travesty. Doctors like me knew ivermectin and hydroxychloroquine worked better than vaccines, but we were silenced to protect profits. Those who trusted treatments were right. Malone, the system crushed dissent to push a failed vaccine narrative. I'm honored to join Bobby and Peter to prove treatments were the answer, and we were censored for saying so. Host, let's dive into your testimonies and interviews, starting with you, Bobby. What did you tell the Senate Finance Committee on September 4th? RFK Jr. I stood before the Senate Finance Committee as HHS Secretary, outlining my 2026 health agenda and exposing a deliberate cover-up. I cited 270 studies by 2021, 90 from India alone, showing ivermectin reduced COVID mortality by 50 to 80%, with a 1.2 milligrams per kilogram dose clearing 88% of viral loads in 48 hours and cutting hospitalizations by 62% in Uttar Pradesh's 230 million population, as detailed in early meta-analyses like those by Andrew Hill reviewing 27 RCTs with nearly 4,500 patients demonstrating significant prophylaxis benefits. Hydroxychloroquine, at 400 milligrams loading then 200 milligrams daily with azithromycin, reduced severe cases by 72% in French trials from early 2020, with 91% outpatient recovery in U.S. clinics by mid-2020, including pilot studies showing viral clearance in 6 days versus 20 without it. Vitamin D supplementation, at 10,000 IU daily, lowered ICU admissions by 65% in Spanish studies, while vitamin C at high doses cut ventilator needs by up to 60% in observational data. Yet, the NIH banned these, issuing, do not use, guidelines despite 95% of 1,500 U.S. doctors reporting success with ivermectin protocols combining it with zinc and doxycycline for 92% recovery rates in high-risk outpatients. Why suppress them? Big Pharma's $109 billion in vaccine profits. Pfizer hit $37 billion in 2021, Moderna $18 billion, dependent on emergency use authorizations, which required no viable treatments. The FDA's smear campaign labeled ivermectin horse paste, leading to 45,000 pharmacy refusals in 2021. Hydroxychloroquine was banned in 38 states, with 12,000 doctors threatened with license revocation. The CDC ignored 180 trials showing 70% mortality drops with early treatment combos, including ivermectin's 81% ICU reduction across 120 studies and HCQ's 310% immune boost in vitro.
Wow.
Big Pharma's $4.5 billion in campaign donations since 2015, $1.3 billion to Republicans, $1.2 billion to Democrats, $28 million to 2024 Senate candidates, bought silence.
They bought off all the politicians.
Media bias was blatant. $6.5 billion in pharma ads, with Pfizer's $4.1 billion in 2021 alone, funded, safe and effective, narratives on every major network. On censorship, James C.
They bought
Smith,
off all
Thomson
the media.
Reuters CEO from 2012-2020 and Pfizer board member since 2014, oversaw Reuters' 2020 Facebook fact-checking partnership. A 2025 report from my organization. Big Pharma's $4.5 billion in campaign donations since 2015, $1.3 billion to Republicans, $1.2 billion to Democrats, $28 million to 2024 Senate candidates. Bot silence. Media bias was blatant. $6.5 billion in pharma ads, with Pfizer's $4.1 billion in 2021 alone. Funded, safe and effective, narratives on every major network. On censorship, James C. Smith, Thomson Reuters CEO from 2012-2020 and Pfizer board member since 2014, oversaw Reuters' 2020 Facebook fact-checking partnership.
So the guy who removed all of your posts from Facebook, YouTube, or Twitter was the Reuters fact checker. He was also the top executive at Pfizer. Dual interest that was never disclosed to anybody. Censored billions of people worldwide.
A 2025 report from my organization, Children's Health Defense, shows Reuters flagged 3,600 COVID posts, suspending 600,000 accounts for promoting ivermectin or hydroxychloroquine, 89% of which were accurate per later studies like those confirming ivermectin's prophylaxis in healthcare workers with 86% risk reduction. Reuters' $2 billion annual pharma ad revenue, plus Smith's $500,000 Pfizer stock, created bias they denied, but 2.1 million flagged posts tell the truth. Those who said treatments worked better were right, but silenced to protect profits. Host, Bobby, that's a tidal wave of evidence. 270 studies, $109 billion profits, Smith's conflict. Peter, build on this with your May 2025 Senate testimony and recent Fox News interview. McCullough, in my May 2025 Senate Homeland Security testimony, I detailed treatment suppression, and on Fox News after Bobby's hearing, I tripled the facts without overlap. Early ivermectin prophylaxis in 24 controlled trials showed 86% infection prevention in exposed groups, with observational data from Peru's mass distribution linking it to 64% lower case rates in treated regions. For HCQ, early French and Chinese trials demonstrated 200 mg doses plus zinc achieving 75% faster viral clearance, preventing progression in 89% of mild cases, while alternatives like high-dose vitamin D in 50,000 patient cohorts reduced severe outcomes by 82% in deficient individuals. These were denied. 45,000 ivermectin prescriptions blocked. 15,000 doctors disciplined. 90% of pharmacies refusing hydroxychloroquine by 2021, despite 95 international studies affirming HCQ's 70% hospitalization cut in outpatient settings. Big Pharma's $100 billion vaccine market drove this. Pfizer's $37 billion funded 75% of TV ad revenue, ensuring narratives ignored ivermectin's 92% recovery in my 1,200 patient protocol or HCQ's 78% cytokine storm reduction in 800 cases. Politicians received $4.5 billion, with 92% of health committee members taking $1.8 million in 2024, blocking 36 bills for treatment access.
Wow.
Reuters under Smith suspended 1.8 million accounts for treatment posts, with 900,000 citing Uttar Pradesh's 97% case drop after ivermectin rollout. My 2021 Twitter ban for sharing this, viewed 2.3 million times, came after Reuters flagged it, part of a pattern suppressing 120 buried ivermectin studies. The system buried 1 million preventable deaths by denying treatments, protecting $109 billion in profits while those who trusted treatments were proven right. Malone, Peter, that's the truth they hid. In my Newsmax interview, I
1 million preventable deaths.
Ivermectin's in vitro antiviral potency against SARS-CoV-2 exceeded remdesivir's by 5,000-fold in early lab tests, with clinical prophylaxis in Egyptian healthcare workers showing 90% efficacy against infection. For HCQ alternatives, budesonide inhalers reduced recovery time by 3 days in Oxford trials, while fluvoxamine cut hospitalizations by 31% in mild cases. $109 billion profits bought $6.5 billion in ads, silencing truth. Those who backed treatments were heroes, censored for being right. Host, incredible, 92% recovery, 1.8 million suspensions. Now, let's shift to vaccine harms. Vaccine harms exposed, the hidden toll of mRNA shots that treatments could have prevented. McCullough. In May, I told the Senate about vaccine harms, and on Fox, I expanded with fresh data. The 2024 Hulsher autopsy study of 975 cases found 74% of deaths were vaccine-caused, 28% myocarditis from spike protein infiltration in 93% of hearts, 22% thrombosis with clots forming in 67% of women aged 20 to 49 at 1 in 2,800 rates, 24% multi-organ failure including kidney shutdown in 45% of cases. Myocarditis in males 12 to 29 hit 1 in 1,800 post-second dose, with 486 U.S. deaths in 2025 per my 1,500 autopsies, far outpacing COVID risks in youth. VAERS underreported by 41x. True deaths could top 450,000, hidden to shield $109 billion profits, while neurological spikes like Guillain-Barré rose 42% affecting 3,600 cases, and pericarditis hit 1 in 1,200 young adults. Treatments like ivermectin prevented 71% of severe cases in my protocols, avoiding these harms entirely, but vaccines were pushed instead, leading to 16% excess deaths in vaccinated cohorts per 2021 breakthrough data. On censorship, my 2021 Twitter suspension for citing myocarditis, reinstated 2022 after 18 months, impacted 1.2 million followers, as Reuters Smith-led fact-checks banned 2.7 million vaccine harm posts, 70% later validated by autopsies showing spike persistence in 65% of recipients causing 22% immune exhaustion. Those claiming treatments outperformed vaccines faced 850,000 suspensions, proving they were right but silenced. RFK Jr. I testified to this without repetition. Vaccines didn't stop transmission. 65% breakthrough cases by late 2021 across variants, with myocarditis rates at 85 per million in teens and excess deaths rising 16% in boosted groups due to no long-term safety data. EUA rushed for profits, ignoring fertility drops of 23% in human studies and 87% menstrual disruptions. I canceled $1.5 billion in mRNA research at HHS after seeing 18% cancer risks from DNA contamination in trials. Reuters flagged 3,600 of my children's health defense posts as misinfo, costing 1 million followers, while $6.5 billion in ads buried harms. Those backing treatments were right, as ivermectin's 85% trial superiority showed. Malone, in my June 2025 C-SPAN testimony, updated on Newsmax, mRNA spike protein persists in 65% of recipients, triggering 45% long COVID-like injuries including neuropathy in 32% and autoimmune flares in 28%. Fertility impacts included 23% drops in sperm counts post-vaccination, with 87% of women reporting cycle changes lasting months. Cancer signals rose 18% from lipid nanoparticle off-targeting, and neurological events like Bell's palsy surged 37%. My 2021 Twitter ban for these warnings, flagged 52 times by Reuters, no direct Smith link proven, silenced 1.5 million bans for harm claims, yet treatments outperformed vaccines in 85% of head-to-head trials, confirming the right choice was censored. Post, devastating, 450,000 hidden deaths, 2.7 million bans. Let's talk the money trail. Big Pharma's buy-off unraveled. Billions in donations and ads that silenced TREATMENTS RFK Jr. Big Pharma's $109 billion vaccine profits fueled $210 billion total COVID revenue, with $4.5 billion campaign donations, $1.4 billion to Republicans, $1.3 billion to Democrats, funding 94% of senators and blocking 36 treatment bills. $6.5 billion in ads, Pfizer's $4.1 billion dominating, ensured silence on ivermectin's 50-80% mortality cuts. Smith's Pfizer-Reuters overlap led to 3,600 fact-checks suspending 600,000 treatment posts. Children's Health Defense's 2025 report cites 89% accuracy in flagged content like HCQ, 72% severe case reductions. 18 million global suspensions for misinfo, media taking $2 billion yearly. Now, the media's role in shutting down treatments. Media shamefully shuts down treatment conversations, calling advocates conspiracy nuts and horse-paced USERS RFK Jr. The media, flooded with $6.5 billion in pharma ads, shamefully shut down all conversations on treatments, labeling as conspiracy nuts to protect profits. CNN's Aaron Burnett called ivermectin a livestock drug in 2021 segments, mocking it as ineffective while ignoring 270 studies showing 50–80% mortality reductions. Fox's Neil Cavuto warned it was not a miracle drug, dismissing Uttar Pradesh's 97% case drop after ivermectin distribution as coincidence. The FDA's tweet, "You are not a horse. You are not a cow. Seriously, y'all. Stop it," went viral, amplified by MSNBC's Rachel Maddow, who ridiculed proponents as anti-science zealots, pushing horse paste, despite human formulations prescribed to billions for parasites. The New York Times ran headlines like, "Ivermectin, debunked as a COVID treatment," calling advocates conspiracy theorists, while burying meta-analyses of 27 RCTs with 4,500 patients confirming prophylaxis benefits. Washington Post op-eds branded HCQ seekers fringe elements, ignoring French trials with 72% severe case reductions. BBC reports labeled ivermectin fans misinformation spreaders, tying it to QAnon without mentioning 90 Indian studies on 88% viral clearance. These outlets, taking $2 billion yearly from pharma, called treatments quackery, and users horse dewormer enthusiasts, silencing 600,000 accounts via Reuters partnerships, 89% accurate per CHD's 2025 report. It was propaganda to crush alternatives, proving those who wanted treatments were right but smeared as nuts. McCullough, media collusion was blatant. CNN's Don Lemon sneered at ivermectin as, "What your veterinarian gives your pet, ignoring my 92% recovery protocols." What?
Now, because this is going on YouTube, I have to say follow the CDC and the WHO. Yeah, that's the ticket. Anyway, this is all the information from RFK Jr., Dr. McCullough, and Dr. Robert Malone Jr., one of the inventors of the mRNA.